Good evening, and welcome to this special edition of Doctors on Call on the COVID-19 pandemic. I'm Dr. Paula Termuhlen, Regional Campus Dean at the University of Minnesota Medical School Duluth Campus, and I'm your host for our program tonight. We're continuing this series of special programs to answer viewer questions about the coronavirus, and tonight we have a special emphasis on how the pandemic is impacting underserved communities and people of color, and in particular our Native American communities. Tonight's guests will share what they have learned to help keep you and your family safe. The telephone numbers and email address for your questions can be found at the bottom of your screen. Our panelists this evening are both alumni of our medical school and include Dr. Arne Vainio, family physician at the Minoawan Clinic on the Fond du Lac Reservation, and Dr. Mary Owen, faculty member at the University of Minnesota Medical School Duluth Campus and family medicine physician at the Center for American Indian Resources of the Fond du Lac Nation. Members of the WDSE staff are standing by to take your calls and emails, and I want to thank the staff for keeping us safe and social distancing, and we've cleaned our hands and we've got masks in place behind the cameras, so we're very excited to get going with your calls and emails, and we thank you for your questions. So once again, let's get started. So Dr. Owen, I'm going to ask this question of you first. I know you've been having a lot of conversations related to tribal health on a national level. Can you just sort of give us an update on where we stand?
It's going to be different in different areas. Like obviously, you know, the Northwest tribes were some of the first hit, as Seattle was a hot spot.
Yeah. And
they're just starting to get through that now and looking at different ways to open up. They've come up with lots of models at the Seattle Indian Health Board, one area there to deal with the different problems. Southwest, of course, as we know, is being the hardest hit right now. I believe they have had 85 deaths among the Navajo Nation themselves. So they're still very much in the thick of COVID-19. And then other areas like our tribes here are just anxiously still waiting. So it'll depend on the area that you're at. We have some commonalities, though, that make us more susceptible. So that's why all of us are pretty anxious about how this is going to impact our communities. We live in crowded conditions oftentimes in our communities because of issues around poverty. We don't always have the sanitation. We have high morbidities already, or high amounts of chronic disease that make us more susceptible. So lots of different factors make us a little more vulnerable than most populations.
Well, and so Dr. Vainio, what are some of the sort of healthy ways that your community is working hard to keep itself safe?
We are doing social distancing and all the things that are recommended. We're trying to we're doing a lot more telemedicine visits now and trying to keep people from coming into the clinic. You know, that being said, people should still come in if they have injuries. You know, people should go to the emergency room. Visits are down. And, you know, people would still be having strokes and heart attacks and all that stuff at the same rate they would have before. So people are waiting to before they come into the emergency room, and you should not do that. If somebody has chest pain, if somebody has signs of a stroke, you know, can't talk, lose their balance, can't move one side, they should be in the emergency room.
Well, and can you tell us a little bit about, we were talking ahead of the show about some of the precautions that we take to help protect our patients when they come in to see us.
So we do a lot of the things that most of the other clinics are doing. Again, we're trying to do telemedicine visits when we can. I did a nursing home visit by video, you know, with an iPhone today. But so everybody that comes into the clinic, including everybody that works there, gets their temperature screened when they come in. Do you have a new cough? Do you have shortness of breath? Get asked a series of questions, and then when patients come in, so like we have a respiratory provider, so everybody else in the clinic is still doing what they normally do, and only one provider is taking all of the respiratory calls for that week. So calls that are coming in, or patients that need to be seen if they have a cough, if they have upper respiratory symptoms, then one provider with one nurse, and they're a team, and they stay in a separate part of the clinic and do that to avoid exposing everybody else.
Yeah, so I think those are some of the strategies. I know many hospitals and clinics across our area have really worked hard to keep everyone safe and to make sure that people come in if they have a problem. Another thing I know we were just talking a little bit before the show went on was about testing. And can you talk to us a little bit about what's being offered at your clinic and who gets it?
Yeah, so testing has testing has not been available for quite a while, and it's just starting. So this last week we started doing drive-up testing and that's only at our clinic in Cloquet, and we have the Abbott ID Now test, and that's a test that we can run in 15 minutes. That we have a limited number of those, so we use those for high-risk people, for healthcare workers, for people that work with people that are chronically ill, cancer patients and chemotherapy, anybody that's really high risk. We use that one. Otherwise, we send out our tests to Mayo, and those come back in 24 to 48 hours. And so our drive-up testing is pretty involved, pretty complicated. Again, a dedicated team. We do that from 1:30 in the afternoon till 3 o'clock. And patients have to have appointments to come up. Before they get tested, they call the triage nurse. The triage nurse then decides if they need to talk to a provider, and then a provider will do a telephone visit with them and then order the test. But people can't just drive up off the street and get a test.
Okay. So, Dr. Owen, you and I both work for the university, and what kinds of efforts are going on to help support the tribes in our area?
Well, on a student level, a couple of areas. Dr. Anna Huerta has developed some handouts and some prints that are attractive to young people and for some of the kids in our communities, specifically around COVID-19. A couple of nice documents that people can.
Yeah, they're beautiful.
Yeah, I think you can find them now. We're putting them up on our website, or access to them on our website at the Center of American Indian Minority Health. Other thing is that the university has been meeting with tribal leaders and tribal health directors to try to assess what they need and to help find out what's happening when the rest of the communities around the state are getting the surveillance testing. What does that mean for the tribes, and how's that going to be done in a good way? Because it's not always as easy for state agencies to work with smoothly with tribal governments without a lot of agreements, because tribal governments, of course, are tribal nations.
Sure.
So they have to iron those pieces out to make sure that the tribes are protected but still get the services they need.
Right, and I know you and I talked earlier in the week a little bit about the complexity around these kinds of arrangements. Part of it's around trust, too.
Yeah, it's almost always around trust.
Yeah, so it's nice to hear that really there's really a significant reach out that's occurring right now to try to identify the areas that where we could offer assistance at both the state level, at the university level, and within the communities. So
I agree, and it's going to be really important because this is by far not the first, and it won't be the last time that we go through something like this. And so if we can make a system that's more long-term, then we're doing everybody
it's all about building
service.
Relationships.
That's right.
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 Well, and I think one of the things that we were also talking a little bit about is the fishing opener is coming up this weekend, and Leech Lake is a place where people like to go. So,
in fact, some of those resorts are already booked way ahead of time, and so the tribal members are very concerned about it. If you look at Leech Lake, Highway 2 goes right through the middle of it. People stop at gas stations, gas up, get their, the fish that you catch fish with. Sorry, bait. I don't fish from around here. I'm fishing from Alaska, so I won't do it here. So, and then they're coming in contact with tribal members who, again, are more vulnerable. So our tribal nation leaders are very anxious to see how this goes.
Well, and I know different tribal nations around the country have actually limited access completely, just really stopped people at the borders, but we can't really do that.
Well, Red Lake can, and they have.
And they have. Okay, good. So another question that we had, we know that we hope we don't get to a place where with COVID-19 that we'll lose any members, but the idea that end-of-life decisions might be made a little bit differently in Native communities. What might that look like?
I think what that gets to is that people presume when we make these choices on shortages that you're always going to, that the precious resources will go to the most healthy in our community, right? The younger, the most healthy. But in Native communities, there's a difference in value in that we value our elders significantly, probably more so than some non-native communities. And for us, they are a very precious resource that you don't take lightly, and you don't just automatically say this young person is more valuable to them. Not that anybody designates anything that way, but we just look at the question a little differently. They are our tradition holders. That they help us to know which way to move forward in life.
Well, and I can imagine just even practicing some of the traditional activities. For example, I saw online powwows were taking place. And so just can you talk to us a little bit about how some of those traditions are being handled in the era of social distancing right now?
Yeah, so powwows have been a big thing, and they're planned way in advance. And those things have just been canceled. There's a lot of ceremonies and traditional things that, when I talk to patients, those are things that we should be able to, that should be our source of comfort. And with this, it's not. It's you could easily get COVID-19, from somebody in a close setting in church or at a ceremony or something like that, and which is a difficult. It's a difficult sell sometimes, because that is where we go when we're looking for comfort and we're looking for answers.
Sure.
But some of our tribal members are trying to make up for that through the social media and having these online social powwows and other means of, and it's created new ways to reach out that we hadn't thought of before. Yeah. I know in South Dakota, for instance, this is not one of our traditional ceremonies, but I know that in some of the communities, people are just driving by houses and waving to folks in the windows to make sure everybody's okay, on some of our more rural areas.
Yeah, and I have somebody that I really respect and who teaches me traditional things, and he actually does a lot of the ceremonial things that he needs to do by Zoom, and he does it, by
modern
Zoom and
Indians.
Skype. Yeah, totally modern.
Well, and we were talking earlier, so with our medical students, we typically have the white coat ceremony when they, come into medical school and take on sort of the profession of medicine. And one of the most beautiful aspects of that is to have our drumming. And so thinking about what that might look like when we do that in the fall, well, be it virtually or in person, we hope in person, but we're thinking about that and how we can still include that kind of an experience, because it's important for our students, for all of our campus members. So.
Yeah, and even looking at graduations, and people can't be together to graduate now, and that goes to all graduates. There was a Native American or Indigenous graduation ceremony online, and I was actually one of the speakers for that.
Oh, fabulous!
And just talking to, and that can be graduation from kindergarten, from medical school, from high school, from anything, from tech school, and the bottom line is we need all of us, and congratulations to anybody who's graduated from anything.
Oh, and I agree. We had our medical school graduation last week, and we did it all online and had a speaker. And what was really special about it is how many people were able to join who may not have been able to be there in person. It's sort of a silver lining, even though it would have been much more. I really would have loved to have been there in person, but at the same time, there was a dimension to it that was actually nice to see the extra people that were able to attend.
That's a really good point, that it's pointing out to us people who have been left out before, and now we're able to include.
Yeah. Well, so we're getting some calls from our viewers tonight, and so Dr. Vainio, we have one directed to you. Lisa would like to know if rigorous cleaning, and people are doing a lot of cleaning right now, can it cause an elevated heartbeat and arrhythmia, and if so, should she be concerned?
Clean your house, Lisa. So.
Got to clean the house.
I mean, you have to clean pretty hard to get an arrhythmia, I think. And, this is a time when a lot of people are cleaning and doing spring cleaning, and, it's a good time.
But chest pain should bring you to the doctor.
Chest pain or arrhythmias should bring you to the, should bring you to the doctor. But.
All right. Here's one that's we've had a couple of times, and I'm really glad we have a chance to get it on here tonight, which is, when might people who are employed as massage therapists, barbers, hairdressers, spa personnel, when do we think they might get be able to go back to business, those high-touch professions?
I say when the governor tells you we can go back to doing that work. Doctors are high-touch position, it's a career where we touch a lot, and even we're backed way off from our patients and trying to do it as much virtual unless we have to come in contact for the diagnoses.
Yeah.
So it's going to be a while.
Yeah, I really miss my massage. I get them regularly, and so I can't wait myself. Here's a question. From the moment of infection, how soon is transmission possible?
4 days.
Is it 4 days? So, so the incubation period for the COVID-19 virus, people can be infectious for several days before they get any symptoms, and that's why everybody's wearing masks, and that's why people are waiting on mandates to when people can go back to work, when the stay-at-home orders can be lessened somehow. If you look back at the 1918 flu pandemic, it was the second wave that was the worst, and that came in the fall of 1918. And the spring is when the first wave came, and then people did socially distance and they did a lot of the right things, and then just like now, it affects people's lives. Businesses, there's business that are going on. I get it. When people are having a hard time, but loosening things up is, history repeats itself.
Yeah, it's a risk. So we have a question. We always get at least one question every week on masks. So this one is, how long can a cloth mask be worn before washing?
Well, not everybody's going to have access to washing machines and be able to wash them immediately, or water, right? Mm-hmm. So you do what you can. Generally, I think after a day of wearing yours around, particularly if you're outside and doing things with other people, you're going to want to wash it. But again, it's going to decide on what you're doing and what you have the capacity to do. And you don't have to have a wash machine. You could just, you could throw it in you might not have a dishwasher either, but you can just use soap and water and hang it to dry. Mm-hmm. Do you advise anything differently, Dr. Vainio?
No. So I wear, it's right there. I wear a cloth mask all day long, and I'm afraid that one of my ears are going to stick out permanently. And but I wash it every day. Yeah. And and if people do have access to be able to do that, and it's a cloth one, there's some of the paper towel masks, and those don't stand up as well.
And bandanas. I've seen people wearing bandanas. Just anything to really, because the mask is really designed to keep us from our droplets going to someone else. So.
And the less light you can see through them in general, the safer, but the more safe ones are needed by the health professionals, right?
Yeah,
more
ones that are the high filtration.
Right.
So another caller from Cloquet would like to know how accurate are forehead temperature taking devices, or should we be using different devices?
I think they're okay.
Yeah.
Just as accurate as the others.
Yeah.
Yeah, that's what I've heard too.
In pediatrics, I always learned that when I was in medical school, I remember a pediatrician saying, those parents holding their hands to their kids' heads, those are accurate. Parents can feel a fever.
Yeah.
So.
And if you feel ill. Mm-hmm. So we have a question about the warm weather. Will it promote this virus or slow it down? Or do we know?
I don't think we know what weather's going to do to it.
Nope.
Yeah.
We don't know.
It's hard to say. We've really been promoting the idea of fresh air and getting out a little bit, but we really don't know. There's so much that we're learning week by week about this particular virus. So here's a question about, why are the Minnesota numbers rising right now in terms of cases, and what might it be due to? And again, is it because people aren't wearing their masks, or is it due to something else?
There's better testing.
And more testing.
More testing.
A lot more testing.
Right. Yeah. I was talking with someone earlier today who said early on when we started all of this, and I suspect the two of you would have made the same recommendation, they never got tested. They just stayed home and isolated. Mm-hmm. And I can almost guarantee, after having been on the show now for over a month, that this person had COVID. You could tell. And so it's I said, well, you'll have to get the antibody testing once we get that figured out.
And we haven't got that figured out. So the antibody tests are, you can see why people would want to have those tests, see if you have immunity to the COVID-19. But the tests, there was such a rush to get those things out there that it was just kind of the Wild West, for making those things. And there's a lot of bad tests out there. Yeah. So, you don't really,
And we don't know even if you test positive, we don't know how long that's going to last. Right. There's just so many unknowns around it. CDC doesn't recommend it. The World Health Organization doesn't recommend it. So.
And I just saw this week the FDA is really now cracking down on those particular tests and saying, okay, hold off until we get more information. So
what's really frustrating is the fraudulent sellers out there making a buck off of these things, and people being vulnerable because they're frightened.
Yeah. So we have a question about alternative medications. Chaga is one I'm not familiar with, but that's the one that's being named. And can it help with COVID-19? So maybe just in a general term, do we know of anything right now that can either help prevent or treat COVID?
From a scientific standpoint, I haven't seen anything. Chaga, a lot of people use for a lot of different things. I have chaga tea. And chaga is like a mushroom or a fungus that grows on birch trees, and there are the traditional medicines that people are using that are fine, and I encourage people that if they have traditional things that they do, they should do them, and I usually want to know about them, but I use some traditional medicines myself, but there's vitamin D is thought to be helpful, and but I don't know if anything in particular has been shown to be beneficial.
No, I would just say though that chagas, along with a lot of our other traditional remedies, have been shown to improve immune system response in general. So I don't think, like you said, Dr. Vainio, we don't have any Western proof of those, but I don't think that they're going to harm. And certainly, just like we say with colds, the more hot liquids, that it's a good idea to drink those hot liquids, hot soups. So.
Yeah, I've been drinking a lot of tea, and I know that in particular is a lot of different kinds of antioxidants too, can really at least help us ward off other things if it's not going to be COVID. But one thing kind of on a related topic that I think is on our viewers' minds, but also one that I think is important for us to talk a little bit about are immunizations, both adults and children. We know right now we don't have a vaccine for COVID, but what about all those other vaccinations that we might be getting?
We should be getting our vaccinations. So, and especially kids, well-child visits and vaccines are extremely important. We don't want kids to get behind on things. So, in our clinic, Monday mornings are reserved for well-child visits and vaccinations, and we absolutely want to make sure that kids are getting those things. And flu vaccines and other vaccines are important too.
And I think clinics are increasingly set up just for those days, like you say. They don't have other patients in at that time to try to minimize the risk to children. But, we already have outbreaks of measles in different communities, so we don't want our kids getting behind on their vaccines. And adults, the same thing. Even though if you get pneumonia, it's not because of COVID, but you are more susceptible to other diseases when you have COVID in general. You can get sicker, so you want all those immunizations.
So we know that people are under a lot of stress right now for all kinds of reasons. And one of our viewers would like us to talk a little bit about some of the mental health challenges that you might be seeing more frequently in your clinics right now. And what kind of resources might we have for folks?
Well, people are afraid and they are stressed. From an Ojibwe standpoint, again, one of the elders that I talked to, typically Native people have gone on a fast at some point in their life, and it's a thing that helps you find your vision, and it's a time when people don't eat and they don't drink, and they're isolated, and their life's purpose oftentimes will come to them during that time. And his thought was that we should be treating this time as a fast. This is a time to look within ourselves and look for strength. And he says that everything that we need to find the answers is already inside of us, and we need to trust that, and we need to find that and look for it.
I would agree with that. I also want to mention that I know that we already have high rates of depression, anxiety, and suicide among Native youth, like other vulnerable populations. But we suspect that there's probably going to be a disproportionate higher amounts in our communities. And I know that some students, some people are already reaching out and trying to do things. So within our medical school, we have a group of, I don't believe I mentioned this one already, Native medical students who are creating online resources for young people throughout our communities, just to let them know that others are thinking about them so that they don't feel so alone. And then they're also doing sets of memes and enlisting a text service that will send out a text at least once or twice a week to people with resources and good thoughts and hope.
Well, and I'd say everyone's welcome. All of our local hospitals have hotlines. We also have the national suicide numbers for anyone who's truly desperate. And so thinking a lot about reaching out and being kind to each other. I really appreciate that idea of treating this time as a fast. We're fasting in some ways from our regular routines and being able to use that time reflectively. Maybe we'll get something out of it. We can only hope. So we've got time for one last quick question, which is, my senior insists on traveling in cars with multiple friends. How at risk is she?
In 30 seconds?
In 30 seconds.
She's very at risk.
Yeah. So social distancing. So with that, I think we're about ready to close down for tonight, and miigwech for our panelists. Dr. Arne Vainio and Dr. Mary Owen and our phone staff and crew for being here this evening. Please join me again next week when our guests will be Dr. Amy Greminger and Dr. Jonathan Sandy. Keep up the good work. Continue to practice physical distancing, wash your hands, and sanitize those surfaces that you touch. Thank you for watching, and have a healthy week.